Welcome to The Explainer. Today we're diving into the modern approach to testicular cancer. And, it's a disease that, despite how serious it sounds, has become one of medicine's biggest success stories. So let's take a look at how it's diagnosed and, more importantly, how it's treated.
So let's just kick things off with a fact that really grabs your attention. For young men, this is the most common solid tumor they might face. It's a serious diagnosis, for sure, but that is definitely not the whole story.
Because that serious fact is immediately followed by what is, without a doubt, the single most important number you're going to see today.
That's the overall cure rate. So right from the very beginning, the key message here is all about hope and incredibly high success rates. Okay, so let's get into why that is.
All right. First up, let's cover the basics. What exactly is this disease? And why is the prognosis so overwhelmingly positive?
So while it is the most common solid tumor for this specific age group, it's actually pretty rare overall. It only makes up about 1% of all cancers in men. Now, here's the really crucial part. 80% of cases, that's 8 out of 10, are caught at stage 1, often just discovered as a painless lump. And this early detection is a huge reason why, from day 1, a cure is the expected outcome. Okay, so after the initial surgery to remove the testicle, that's a procedure called an orchiectomy. The lab results come back, and that's when you hit this huge fork in the road that basically maps out the entire rest of the treatment journey.
Nearly all testicular cancers start in what are called germ cells. But, and this is the key thing, from that one common starting point, they evolve into 2 totally distinct types. And knowing which one you have is absolutely crucial for everything that comes next.
And here it is. This is that fork in the road I was just talking about. On one path, you have seminomas, which are super sensitive to treatments like radiotherapy. On the other path, you've got non-seminomas. Their treatment path is different, and they often reveal themselves through specific proteins. These tumor markers that can be measured with just a simple blood test. This single distinction changes the whole game.
So let's zoom in on the most common scenario, a stage 1 seminoma, which is where the cancer is still confined just to the testicle.
Now, after that initial surgery, doctors know there's about a 15 to 20% risk that some microscopic cancer cells might have escaped to nearby lymph nodes. So to manage that risk, there are 3 main paths you can take. And here's the core decision, laid out really clearly. The first option is called active surveillance. Basically, you avoid immediate treatment side effects, but it requires really intensive monitoring, and you accept that 15–20% chance of a relapse. The other 2 options involve what's called adjuvant treatment. Think of it like preventative care. Both radiotherapy and chemotherapy knock that relapse risk way down to under 5%. But of course, they come with their own potential long-term risks. It's a really crucial trade-off.
Okay, so let's focus on radiotherapy for a second. Because for those who go down this path, it's just a fantastic example of how medicine has evolved to become so much smarter and safer over time.
For decades, the standard way of doing radiotherapy was kind of like a scorched earth policy. To be absolutely sure they got everything, doctors treated a really large area of the body. But as you can imagine, this came with some pretty significant side effects. But over time, really careful research showed that relapses down in the pelvis were actually pretty rare. This one insight was a total game changer. It allowed doctors to safely shrink the treatment area from that big dogleg field to a much more focused para-aortic field. And the result? A dramatic reduction in side effects and an estimated 45% lower risk of developing a second cancer later on in life. Just incredible. But the innovation didn't stop with just a smaller target. A landmark study then compared 2 different radiation doses, and the result was crystal clear. A lower dose of 20 gray was just as effective as the old standard of 30 gray. I mean, look at those relapse rates. They're nearly identical. And just like that, a new, safer standard was established with even fewer side effects. But, what happens if the cancer is found at a later stage? Or what if it comes back after a period of surveillance? Well, the key takeaway here is that even for these less common scenarios, the story of success just keeps on going. For more advanced disease or even for a relapse, there are well-established, incredibly effective salvage options. The answer is almost always a highly successful course of platinum-based chemotherapy, and those amazing cure rates, they hold strong. So what does this entire journey mean for someone who's actually facing this diagnosis today? I think this quote from the source material just sums it all up, doesn't it? The mindset from day one, from the doctors and for the patient, is that a cure is the expected outcome.
It's the baseline assumption.
And this brings us to the modern reality of treating this disease. Thanks to all this incredible research, the focus has really shifted. It's now about making informed, collaborative decisions that weigh the amazing effectiveness of these treatments against the long-term quality of life for the survivor. And that leaves us with a final, powerful thought. For many patients, the biggest challenge may no longer be if they can beat the cancer, but making the right choice about how. It's a really remarkable shift in perspective, and it just highlights the incredible progress that has turned this disease into one of modern medicine's greatest success stories.